right, starting off my head to toe assessment, I'm gonna begin with the hair and the scalp. I'm gonna be testing for any lesions, any bugs, any moles, anything abnormal with their hair or their scalp. And then I'm gonna move to face symmetry. So I'm gonna look, are their eyes symmetrical? Are their ears symmetrical? Is there any drowsiness in their face? That could be a sign of a stroke. Next, I'm gonna look for pupil dilation with my pen light by shining the light into their eyes and moving it away. And then I'm going to bring my pen light to their nose to see if they can follow it in. And then I'm gonna also see if they can follow to the outer perimeters of 6 points. And then I'm also going to look at the sclera of the eye, if it's any redness, any jaundice, look at the conjunctiva. And then I'm going to move to the nose. I'm going to look up the nose for any polyps, any airway obstruction, any lesions, anything like that. Next, I'm going to move to the mouth, and I'm going to look underneath the tongue, look in the gums, at the soft and hard palate, see if there's any cavities, any swelling in the tonsils, any lesions in the mouth. And then while I'm there, I'm also going to test for their gag reflex. Next, I would have them puff out their cheeks. I would have them smile, and I would have them stick out their tongue and move it side to side. And then I would have them clench their jaw and just see if there's any abnormalities with that. Next, I'm going to test their sinuses right up here and there, if there's any tenderness with those. I'm going to move to the ears next, where I would look in there with the light and see if there's any buildup causing impaired hearing, if there's any inflammation inside of the ear, feel the outside of the ear if there's any tenderness, feel behind the ear if there's any tenderness. After the head, we're going to move to the neck, and I'd have them tilt their head side to side. If the arteries pop out, that's obviously an issue. We're going to palpate their arteries, note if the pulse is bounding, if it's weak. Also take the bell of your stethoscope and listen to the sounds of it. Just make sure that it's not any swishing sound, just assess the sound of it. And then I'm going to palpate the trachea, make sure it's aligned correctly, go behind them and feel here and have them swallow and just make sure that is all normal. And then I'm going to feel around the neck for lymph nodes, if anything's swollen, ask if they have any tenderness, anything like that. Just feel down and around the neck if there's anything swollen, any lumps, anything abnormal. Next, I'm going to move to the shoulders. So I'm going to have them shrug up against my hands. And then I'm going to go down the arms. And so when I'm going down the arms, I'm going to just feel around, just palpate for any lumps, look for any skin lesions, look for any bruises, any rashes, anything like that. We're going to feel for the brachial pulse and the radial pulse. And then while we're here, we're also going to test for their range of motion. So I'm going to test it in their shoulder, in their elbow, have them move it around, move their wrist around, move their fingers around. And then at the end of fingers, we're going to push it down and we're going to just check for the capillary refill. And we'll do that on both arms as well. Next, I'm going to move to the chest, and I like to start with the heart. So all pigs eat too much. So I'm going to listen for a full cycle here, here, right here, 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 and at the apex right here. And if I would also ask if they had any past history with murmurs, and if they did, I would listen at the apex with the bell, and I would just track my way back up and see if I can hear that murmur at all. After that, we are going to listen for the lungs. And so we're doing 6 spots. So we're doing right here, 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 and here. Just listening for any like high pitched sounds, anything abnormal with that. Make sure that you listen for a full cycle, like breath in and breath out. And we're gonna feel around on their chest as well. Just any bumps, check for any bruising, any rashes again, just anything abnormal with the chest area. And then we're gonna go to the back first assessing any rashes, lesions, bruises, anything like that. And then we're going to do 6 spots as well, just kind of in between the scapulas, and just going down the spine and just listening for a full cycle in each spot. And then I would also go here on the side of the ribs as well. And then while we're at the back, I would have them bend over a little bit and just feel down the spine. Make sure nothing seems to be out of place. No sign of scoliosis, just nice straight spine. And then we are going to move to the abdomen. So abdomen, we want to auscultate first because we don't want to disrupt anything in there. So there's 4 spots that I would listen to. So I would listen down by the appendix, up here by the liver, over here by the stomach, and down at the end of their intestines. Just listening. If you don't hear any sounds, there could be some blockage in the intestines, which would be an issue. Just listening for anything abnormal. And then we're going to palpate the stomach. So first we're going to palpate lightly, and while we're doing that, we're just going to ask if anything is uncomfortable, if they have any concerns, and then just asking. And then next we would do a deeper palpation, again just asking if anything discomforts them while we're doing that. Next, ask like when was their last bowel movement, if they've had just any issues with their stomach at all, looking again for lesions, rashes, bruises around that. And then we would go down to the pelvic area. For females, just asking like when was your last period, any troubles like urinating, are they sexually active, if they're on birth control, would they like to get on it, would they like an STD test. Males, just asking if they have issues starting a stream, any lesions or anything down there that they're concerned about. Again, asking if they would like an STD test, anything like that. And then testing for a femoral pulse, just right there on the pelvis as well. Next, I'll move down to the legs, palpating the legs, just any skin lesions, bruises, any rashes, anything like that, any lumps. Moving down the leg, we're going to test for a pulse in 3 places: right behind the knee, on the ankle, and on top of the foot. And then I'm also going to do their range of motion as well. So range of motion at the hip, at their knee, the ankle, and their toes. And then just looking at their toes, especially for like diabetics, just checking out their feet, making sure no toes are going black, anything like that. And then if there's no nail polish on the toenails, just checking for the capillary refill as well, like we did on the fingernails. And that should be it.